Greetings and welcome once again to this biology channel called Learn Bio with Janet. Today we'll be starting Form 5 Biology, Chapter 2, Subtopic 2.1 on Impaired Musculoskeletal System. This topic is by popular demand from Form 5 students who have not studied this topic before. So let's begin. Our topic today is on the impaired musculoskeletal system. Let's look at this word. Musculoskeletal system means the muscles and the skeleton, including the bones and the cartilage and joints, tendons and ligaments that are all used to give us support and help us to move. Okay? And then the word impaired means it has been weakened or damaged, making it less effective. So an impaired musculoskeletal system is one which is weakened or damaged or maybe diseased, making it less effective. Now, what are the causes of an impaired musculoskeletal system? Causes can be unbalanced diet. So unbalanced diet can cause the musculoskeletal system to be impaired or suffer from a disease like osteoporosis. For example, if a person doesn't eat enough calcium and phosphorus in his diet, or does not have enough vitamin D in his diet, can suffer from this disease. Another cause can be unhealthy lifestyle. Lifestyle means the way in which a person lives, including the daily activities that he carries out. Does he do regular exercise? Is an example. Or does he smoke? And so forth. So for example, if a person does not move around enough and does not exercise regularly, then it can also contribute to the risk of getting osteoporosis. Thirdly, the process of aging. So as a person grows older, he may continue to wear out certain parts of his body, and that can cause a problem like osteoarthritis, which we will discuss later, which is the breaking down of the cartilage. Fourthly, it may be a hereditary cause. The word hereditary here means something that a disease or a disorder that can be passed down through the genes, through genes that are abnormal. Okay, and one of the examples of a hereditary disease that affects the musculoskeletal system is muscular dystrophy. Here is a very useful and good overview which I've prepared to help you see and understand at a glance the different diseases that we need to know for the exam, for the Form 5 syllabus. Okay, so let's see some of the conditions and diseases that are related to an impaired musculoskeletal system. The first one is the muscle cramp. We can often see muscle cramps occurring in athletes, especially at the end of a race, right? When you can see their faces, they suddenly feel a lot of pain and then they roll onto the field, onto the ground. Okay, so muscle cramps are involuntary painful contractions of muscles that do not relax. The muscles may not relax for about 5 minutes, and it may recur again, for example, after a while. So I think most of us have experienced this before, one time or another. The second disease, the second condition is muscular dystrophy. Now this is a disease. Now muscle cramp is not a disease, whereas muscular dystrophy is a disease or disorder. It is a genetic disorder caused by an abnormal gene that involves the degeneration, meaning the wasting away of muscles. The muscles will become smaller and smaller, and they will not be able to carry out the function of contracting and moving the body parts. The third condition, which is also a disease or disorder, is arthritis. Arthritis is a disorder involving inflammation meaning swelling, and pain and redness in that area, and degeneration. Degeneration meaning the wasting away or the wearing away of parts of the joints. So arthritis is divided into 3 different diseases. Actually, there are many diseases related to this word arthritis, which is a disease of the joints. But we are going to study 3 here, only 3. So the first one is osteoarthritis. Now the word osteo means bone, okay? So osteoarthritis is a condition where the cartilage wears away, breaks down and wears away at a joint. So this can cause problems because the cartilage helps to reduce friction between bones at a joint. Now the second type of arthritis that we need to study is rheumatoid arthritis, which is caused by inflammation of, which is actually the inflammation of the synovial membrane that surrounds the joint and secretes the synovial fluid. Thirdly, another form of arthritis is called gout, which involves the deposition of uric acid crystals in the joints like the big toe, at the big toe. So these uric acid crystals are very sharp and needle-like, and they prick the tissues at the joint. So it's very painful when a person gets gout. So other than muscle cramp, muscular dystrophy and arthritis, there's one more disease called osteoporosis. This is called the silent disease because there are no symptoms for it until a person gets a fall or breaks a bone. So osteoporosis is the decrease in bone mass due to the loss of calcium from bones. Okay, so here we can see that muscle cramp involves muscles, muscular dystrophy involves muscles, arthritis involves the joints, and osteoporosis involves bones, which are all parts of the musculoskeletal system. So I encourage you to jot down this schematic diagram, which is very useful for revision, especially when you want to, refresh your memory at a quick glance. Then you get all the different diseases here, plus the basic causes or definition. The learning outcomes of this lesson is as follows. State the consequences of an impaired musculoskeletal system on support and locomotion. So we have to be able to state and explain the results or the effects of an impaired musculoskeletal system on support and locomotion. Let's start with muscle cramps. Muscle cramps are involuntary painful contractions of muscles that do not relax, and they can last for between a few seconds to around 10 minutes or more. So it usually occurs on the legs or the toes, and sometimes it can occur even in the stomach region. Now the cause of muscle cramps are as follows. Muscle fatigue, especially after running for a long time or after a long time of exercising. Lack of stretching during exercise. Before the exercise, one should warm up first and let the blood circulation flow and prepare the muscle for the exercise. If not, muscle cramps can occur. Poor blood circulation and a lack of sodium in the body. So we have seen sometimes runners when they are running during the sports day, towards the end they may start to slow down, and then they may just collapse onto the field due to the painful effects of muscle cramps. In the muscle cramp, there is involuntary contractions of muscles. That means this type of contractions cannot be controlled, and they will just keep the muscles will be kept in a contracted state for a long period of time. It's very painful. So the treatment is to apply heat. For example, put a warm towel on the muscle and massage the muscle, and also the person should rest to recover from muscle fatigue. Another way is to stretch the cramped muscle and rub it gently to help it relax. The second example of a condition related to impaired musculoskeletal system is muscular dystrophy, which is a genetic disorder involving progressive degeneration or wasting of muscles. One example is Duchenne muscular dystrophy, which is the more common muscular dystrophy disease. So it is a genetic disorder caused by an abnormal recessive gene on the X chromosome, which is a sex chromosome, and this gene can be inherited, meaning that it can be passed down from the parents to the child. So this gene is an abnormal gene in the sense that it is formed through gene mutation or due to sudden abnormal changes in the gene. For example, in the base sequence of the DNA on the gene. So this caused the gene to have a different code or instructions to make a particular protein that is needed for normal muscle functioning. So this gene will produce a non-functional protein instead of the normal protein that is used to help the muscles to function normally. So for example, we can assign a letter to the gene such as M for muscular dystrophy, small m, and it's on the X chromosome, somewhere in the upper part of the X chromosome. So this gene is a recessive gene, meaning that it's a weak gene. So I'll try to explain that later in the next slide. Another thing is that it involves degeneration or wasting of muscles, as we can see in this diagram. So in the beginning, the child may have normal muscles that are healthy looking, but somewhere between 2 to 10 years, the muscle begins to degenerate, especially around 2 to 4 years, because the muscle will waste away. The muscle will waste away. That means the muscles enlarge due to deposits of fats and connective tissue, but the muscle fibers degenerate and waste away. It becomes smaller and smaller, and the muscle tissue becomes very weak. Okay, so atrophied muscle means a muscle that has undergone degeneration or it wastes away. Just like the word dystrophy. Dystrophy means wasting away of something. So this means that the muscle tissue will become less and less. Okay, so the disease progresses from legs to chest muscles, meaning that it starts off from the muscles of the legs, and then the chest muscles will become weaker and weaker after that, from the bottom to the upper parts of the body. Then patients will at first find it difficult to stand and later on even to breathe. Can you tell me the name of the muscle involved in the breathing mechanism? Yes, it's the intercostal muscles in the ribs. So if these muscles cannot function, then the rib cage cannot be moved up and down to aid in inhalation and exhalation. So in the end, the patient will suffocate and die because the intercostal muscles may not be functioning at all. Now, treatment for this disease is to inject steroids to improve the strength of the muscles. So currently there's no cure for it, and they can only delay the progress of the disease through the steroid injections. So we should be thankful if we have strong muscles and take good care of our musculoskeletal system. Let us discuss a hot question related to muscular dystrophy. Why is muscular dystrophy more common in males than in females? 6 marks. So this type of question can be asked in the essay section. as a HOTS question. Actually, we'll be studying more about the inheritance of certain diseases in chapter 5, which is entitled Inheritance. So here I will attempt to explain it to you, and I've provided a very systematic explanation which can be used for the exams. So you can try to understand it, but if you can understand it, then it's very good. But if you can't, then just leave it alone. Focus on the other contents, the other content that we have here. And you can come back to this topic when you have studied chapter 5 on inheritance, because then things will be much clearer. Okay, let's look at the answer. Chromosome sex X is the one that carries the gene for muscular dystrophy. For people who have muscular dystrophy, the gene is on chromosome X, okay, and symbolized by an X for chromosome X, and the M here symbolizes the gene carried on the chromosome X, the gene for muscular dystrophy. Now, males have only one X chromosome in each cell, XY. This is the pair of chromosomes pair of sex chromosomes in males. Okay, so remember boys, you spell boys B-O-Y. So boys have the Y chromosome, because their name has the Y in it, boys. Okay, but females have two X chromosomes in each cell, XX. Okay, so females do not have the Y chromosome. Okay, they have two X chromosomes. Thus, if a male has just one gene for muscular dystrophy on the X chromosome, symbolized by X small my in each cell, he will suffer from the disease, correct? Because his only X chromosome has the gene for muscular dystrophy, and this means that he has the wrong code. The gene is a code or a set of instructions to make a protein. So he has the wrong code, and his cell will produce the wrong protein, which cannot help in the muscle function. Okay, is because this gene is a mutated gene that has undergone abnormal changes, so the code is wrong. So he will suffer from the disease because he does not have any normal code or gene to help him produce that protein. But if a female has one gene for muscular dystrophy and another normal gene, okay, she is still healthy and normal. So let's look at this pair of X chromosomes on this individual. X big M, X small m. Big M stands for the gene, the normal gene, to produce the normal protein for normal muscle function, healthy muscle functioning. Okay, so this is the gene that most people will have. Although she has one gene for muscular dystrophy, she still has the normal gene on her other X chromosome that will save her. Okay, so she'll be able to produce the, okay, let's read from here. Because the other dominant normal gene for healthy muscle function, X big M, this one, will express its trait, meaning it will manifest or show its characteristic, and that means it will be able to produce the normal protein for normal muscle function. Okay, so it will help the individual to produce the normal protein, and there will be not much problem. And it's a dominant gene. Dominant means a stronger gene. Recessive means weak gene. So X small m is the recessive gene. The gene for muscular dystrophy is recessive or weaker. So it's the dominant gene that will be able to express its characteristic. So genes can be either dominant or recessive. The recessive gene cannot express its characteristic in the presence of the dominant gene. So X small m, the gene for muscular dystrophy, cannot express its trait or characteristic in the presence of the normal gene. So the normal gene will help to produce the normal protein in the individual for normal muscle function. So a female will only suffer from muscular dystrophy if she has two genes for muscular dystrophy in each cell, X small m, X small m. So in this case, she doesn't have any X big M, any normal genes to provide the code for the production of normal protein for normal muscle function. So she will suffer from the disease. Okay, but this is very rare. To get an individual which has this type of X chromosomes in the cell, it means that the father must provide this gene for muscular dystrophy to the daughter, and the mother must also have carry the gene for muscular dystrophy. So it's very rare for it to happen. So overall, if you look at the male and female that gets muscular dystrophy, males need only one gene for muscular dystrophy to suffer from the disease, but females need 2 genes for muscular dystrophy to suffer from the disease. So therefore, the probability of getting one gene is of course higher than getting 2 genes for muscular dystrophy, and therefore males have a higher chance of getting the disease compared to females. Okay, it's more common in males than in females. So here we see the various possibilities of individuals that may have or may not have the gene for muscular dystrophy. Now the first case is a normal male. So for a normal male, the male has the normal gene for normal healthy muscle function on his X chromosome. But the Y chromosome doesn't carry any such gene because it is shorter and smaller. Okay? So males have only one gene for normal healthy muscle function. For females, because they have 2 X chromosomes in each cell, thus they will have 2 genes for normal healthy muscle function, because the X chromosome is the one that carries this gene. So that makes a great difference. Okay, so if the male's normal gene is exchanged for this gene for muscular dystrophy, if he has this gene instead, gene for muscular dystrophy, then he'll suffer from the disease, because he doesn't have any other code or instructions to make any normal protein for normal healthy muscle function. For females, there are 2 other possibilities. The first is if only one X chromosome has the muscular dystrophy gene, but the other one has the normal gene for healthy muscle function, big M. Then this female will still be able to have this code to produce the normal code to produce the normal protein for healthy muscle function. So she is healthy. But she's considered a carrier because she's carrying this muscular dystrophy gene, which can be passed down to the offspring. Okay? So a female only gets the disease if she has 2 genes for muscular dystrophy, which is symbolized by the small m. If she has 2 genes for muscular dystrophy, then she will suffer from the disease, as she doesn't have any code or instructions to make the normal protein for healthy muscle function. Now, if you can understand this, then very good. If you can't, you can just leave it alone, and maybe you can come back to this when you have studied Chapter 5 on inheritance. So do not worry about this part. It's advanced information. The third condition is osteoporosis, which is a bone disease. Osteo is a word that means bones, and porosis is a condition where the bone has many pores or holes. So osteoporosis means bones with holes. So it is a degenerative bone disease where there is a decrease in the bone mass due to loss of calcium from the bones. So the bone tissue is lost progressively, and then that leads to decrease in bone mass. The cause is that, especially for women, they suffer from this disease when they are a bit older, at around 50 or 60 years or 70 years of age. So why is it that women at menopause are at greater risk of getting osteoporosis? Now this is a past year exam question. Why do women at menopause tend to suffer or face a high risk of getting osteoporosis? Okay, so in women at menopause, around 50 years of age, estrogen level starts to decrease because the ovary is producing less estrogen. And then the menstrual cycle will stop because of the low estrogen level. So that is a sign of menopause. Okay, the menstrual cycle is the monthly cycle of bleeding that occurs in women. So that will stop. That's when the woman knows that she has reached menopause, around 50 years of age. So estrogen actually is very important for a woman, for a woman's health, because it helps to keep the calcium in the bones. But when the level decreases, then the bone minerals like calcium will be lost. The bone tissue will be broken down and the calcium will be transferred into the blood. Okay, and that's when the bone mass decreases because the calcium is lost from the bones. So the bone mass decreases and the bones become soft. Without the calcium, they become soft, porous, brittle. So you can see a lot of like big spaces and holes in the tissue of the bone. For the bone that has become osteoporotic, for people who suffer from osteoporosis, the bones have very big, large spaces or holes. So it becomes brittle, lighter, and easily fractured. But from the external appearance, a person may not know that her bones or his bones are already losing the bone mass because the shape of the bones will be like as normal. But inside the bones will be porous and brittle. And brittle means easily broken. Okay. Symptoms are bones are porous, brittle, easily fractured, and the person may have a hunched posture and a bent backbone. Why is that so? Think for a moment. Okay, so in the backbone, there are vertebrae, which are small bones to support the back of the body. So if osteoporosis occurs, these tiny bones will also be affected. They will sometimes break or they may be compressed. Or they may be fractured. So this will cause the backbone to become bent and the person will have a hunched posture. Okay. Now, prevention of osteoporosis is to eat a diet rich in calcium, phosphorus, and vitamin D. All these are used to build strong bones. So you have to write down the reason too. Don't just say, eat a diet rich in this. Must put to build strong bones. Okay. Do regular weight-bearing exercise to stress the bone and build the bone mass. So weight-bearing exercises are those exercises that we do against gravity, like lifting weights, running, jogging, or climbing the stairs. Is swimming a weight-bearing exercise? No, because when a person swims, he or she is supported by the buoyancy of water. So the person will not be working against the force of gravity. So when we do weight-bearing exercise to stress the bone, the body will adapt to that and build up the bone mass instead. Okay, so the human body is very wonderful. If we stress the bone, it will try to build back the bone mass and deposit the calcium back into the bones. Okay, C, refrain from smoking as it decreases bone density. This is from findings about the effect of smoking on bone health. Fourthly, hormone replacement therapy using estrogen can be used on these women at menopause, so that with the high estrogen level, the calcium in the bones will be kept there, will be maintained. Let's look at some pictures that shows the symptoms of osteoporosis. In this part on the right, we can see the healthy bone tissue. And if you look at healthy bone tissue, there are some pores and tiny holes in it. Okay, but in the bone of a person suffering from osteoporosis, we call it the osteoporotic bone, the holes are very big and it looks something like a honeycomb structure or the beehive structure. And you can see the holes are very big where the bone tissue has been lost. So this causes the bone to be very weak and easily fractured or broken because it is very porous. Okay, brittle and porous. So these are some of the words you can use to describe the bone. Brittle, porous, easily fractured. Then we can also look at the posture of a person who has healthy bone tissues. The posture is upright, and there's slight curvature of the spine. That's quite normal. Okay, in a normal person who is not suffering from osteoporosis. But it could be the same person, the same woman in the later years. Okay, when osteoporosis occurs, the person may then have a hunched appearance or a stooped posture. In Malay, we say it's called, in Malay we call it bongkok. And the reason is because the bone, which is the bone, tiny bones at the back, which form the backbone. These are the vertebrae, could have fractured or break or collapsed. Or they could have become compressed until it forms the hunched posture. Okay. Then there's loss of height also from this person. There's a loss of height. The height will become lower than in the younger days. Now another symptom is that when the person falls, or the person will easily break a bone or fracture a bone. Sometimes if the bones are very weak, the fracture can just occur very easily. Okay, for example, at the head of the femur, a hip fracture can occur where there's a crack or even a breakage in the bone. So this can cause the person to become immobilized, and to heal the bone, it will take a long time. Okay, so these are the symptoms of osteoporosis. Right, we've come to the end of this lesson. So please share, like, and subscribe. And in the next few lessons, we will proceed with chapter 3 on nervous system, hormones, and homeostasis. So watch out for the videos. Thank you for viewing, and goodbye.